CCEYA Part 2. We're going to look at records, and as it relates to the CCEYA, records are pieces of evidence that need to be kept in a permanent form, and they are in many cases forms of writing, which can be digital or paper copies, but they are records that are used to determine compliance. Section 82 from the Ontario Regulation 137/15 really emphasizes the fact that records and documents need to be kept for at least 3 years from the date that they are made. So anything that is made within the child care center, a licensed child care center in Ontario, needs to be retained for 3 years. We're going to use the early years portal. You can use the child care licensing manuals, and those are for referencing sections of the legislation or the regulations. So non-compliances as it relates to the CCEYA and subsequent inspections, non-compliances result in a compliance risk level being placed on each provision of the CCEYA, and based on that risk level, there is a point system which feeds into the tier for each licensed child care center that is older than 3 years. So there's critical, high, moderate, and low levels of non-compliance. Critical would be those imminent risk of death for children and harm to children, and low would be that it's not likely to pose a risk, but there are some health and safety concerns. When we look at records as it relates to the license, it is a requirement of the CCEYA under Section 14.1 that every licensed child care center has to post their license, and it needs to be in a conspicuous place or a place where parents, families, individuals can see it as they mostly enter or exit the center. So it has to be able to be seen by ministry staff when they come in, families when they come in, and this license outlines the name of the center, who is legally granted approval to have a license, the address for this license, the number of children, and the age categories for that children for this license, any director approvals or conditions that may be on the license. So ministry required records are health inspections, immunizations for each child, daily observations of children, which is also called the health check for when they come into the program to make sure that they are healthy, arrangements for ill children, accident reporting, daily written records, sometimes called communication logs, sometimes called logbooks, but really it's just a record of what happens in the program each day. Serious occurrences have to be reported, and those records do have to be retained. In many cases, the serious occurrence records can also be retained in the child care licensing system because that is where they're reported. But the notification forms and documents like that are also retained. Administration of drugs and medication forms are retained, and under the sleep policy and supervision, you would retain sleep records for direct visual checks. So the serious occurrence categories include death of a child, allegation of abuse, life-threatening injury or illness, missing or unsupervised child, and an unplanned disruption of normal operation. So these are the 5 categories that must be reported on if any of these situations occur in a licensed child care or licensed or home child care center in Ontario. So serious occurrence reporting, that means that if any one of those 5 categories occur, a report has to be sent to the ministry, and it has to go in within 24 hours of the incident, so not 1 day. It's literally 24 hours, so if it happened at 10 o'clock today, it would have to be in by 10 o'clock tomorrow. And the report has to be posted, so that serious occurrence notification has to be posted for 10 business days. That is the requirement. If there's any updates or change to that notification form based on new information that has been provided or found, it needs to be posted for an additional 10 business days. Administration of drugs and medication. So medication forms are required to have the time a drug is administered and the amount, in addition to the written authorization from families. This document gives you the authorization to administer whatever this medication is to the child. So whatever is not included on this document cannot be administered because you do not have written authorization as per the CCEYA under subsection 41D. Sleep policy. It is a requirement under the sleep policy to do frequent direct visual checks. In most cases, infants are more frequent, and then toddlers have a different frequency in terms of the time for direct visual checks. But this does need to be documented, and the documents do need to be retained for children who sleep within the program. So it's required for infant, toddlers, and no longer required for preschool.